Hi, my name is Andrew Rosen. I'm the Chief Executive Officer of the National Ataxia Foundation. And I'm thrilled to be part of the LeadersLink program here in 2025. NAF has a long history. We were founded almost 70 years ago, and we really do two main things. We provide funding for research in the ataxias, as well as support patients and families who have the disease. And we do that in a number of ways, but an ataxia is a kind of a whole set of rare neurological diseases that we're still working on making sure that everyone is aware of. There are tens of thousands of people affected by one form of ataxia or another in the United States. It's partly why diagnosis is so important to us. As we continue to discover new forms of ataxia, we're able to give a diagnosis to more and more people, and it's certainly the first step in eventual treatments and a cure for the disease. Ataxia in some ways has always been at the bottom of the ladder in the movement disorders, certainly not as well known as Parkinson's and ALS and even Huntington's. We're really trying to change that narrative here at NAF, and I think through programs like LeadersLink, we're making real progress there. So when I first applied to LeadersLink, I really had a goal of expanding my network in the rare disease space. I was new to both rare disease and to ataxia when I started at NAF about 7 years ago. So really expanding my network and then really honing in on a specific project that the program had to offer. While my initial focus was on ensuring access for a diverse patient population for our no-cost genetic counseling and testing program, and by the way, that's still important. That's a program we still have. I did pivot my project's focus to increasing NAF's advocacy impact at a national level. That became sort of a top priority for the organization, and I felt like LeadersLink proved to be a perfect catalyst for the work we've done in the space, and I can talk a little bit more about that. Most of our work in advocacy from when I joined NAF was very much grassroots. We relied on volunteers from our patient community. We learned as we went. We partnered with some other organizations in the ataxia space, and we've had some nice success along the way, but we were really interested in sort of taking our advocacy work to the next level. And there were two sort of key elements that really, my participation in LeadersLink really helped unlock, I think, for NAF. First off, a network of really strong patient advocates. I'm so amazed by the work that my fellow LeadersLink participants in my cohort do every day. They have provided great guidance and expertise. A special shout out to my mentor, Mark Hurlbert, for the Melanoma Research Alliance. He's been a wonderful counselor to me over the couple of years in the program. And this whole group is just so inspiring and motivating. And then secondly, another thing that happened as part of LeadersLink is by attending the Milken Global Conference, and thrilled to be part of that, I was able to meet Cheryl Yeager from Crossroads Strategies, who is a leading advocacy advisory firm. And proud to say that we've now engaged Crossroads to help develop and implement a 3-year advocacy strategy for us. We finally have an actual presence in Washington, D.C. Through our work with them, and we're really excited about, again, sort of taking our advocacy work to the next level with their help. If I were going to provide any advice or lessons learned along the way that I would pass along to other organizations that are looking to advance their advocacy work, I would just really encourage all organizations, especially those that are really small or just starting out in the space, to reach out to other groups who perhaps are further along in their efforts. You just learn so much from building that network. It pays off in so many ways. One of the things I just specifically like to call out is it's an amazing reminder that you're not in this alone. I think being an executive director or CEO of a patient advocacy organization can be a lonely fight sometimes. And having this network that a program like LeadersLink allows really makes you feel like there's others out there fighting the fight with you, and I think that's incredibly important.